Ryan Reynolds here for, I guess, my 100th Mint commercial. No. I mean, honestly, when I started this, I thought I only have to do like 4 of these. I mean, it's unlimited premium wireless for $15 a month. How are there still people paying 2 or 3 times that much? I'm sorry, I shouldn't be victim blaming here. Give it a try at mintmobile.com/save. Whenever you're ready.
$45 upfront payment equivalent to $15 per month. New customers on first 3-month plan only. Taxes and fees extra. Speed slower above 40 gigabytes. See details.
How do you feel great on vacation? Like really good? Easy. You go to Aruba. You'll spend your time relaxing on cool white sand beaches and floating in healing blue water. You'll immerse yourself in natural wonder and find your center on an island where things move at your speed. You won't just feel great, you'll feel relaxed, renewed, and ready for life. That's the Aruba effect. Plan your trip at aruba.com.
You're listening to Well Now, Slate's podcast on health and wellness. I'm Maya Feller.
And I'm Kavita Patel. As global temperatures continue to rise, the impact of extreme heat on public health has become an increasingly urgent topic, Maya. Last year, the United States experienced its highest number of heat-related deaths in 45 years, with at least 2,300 deaths directly attributed to excessive heat. Experts actually believe the number could be much higher due to underreporting and misclassification on death certificates, because heat can be a contributing factor but may not be listed as the ultimate cause. We also saw unprecedented rates of emergency department visits for heat-related illnesses last summer, particularly in regions experiencing severe heat waves. The average rate of such visits in 5 southern states was more than double that of previous 5 summers. Let me read that again, Maya. The average rate of visits in 5 southern states was more than double than that of the previous 5 summers combined. These distressing numbers are not solely growing in the United States. For instance, in the summer of 2022, more than 60,000 people died from excess heat in Europe. Extreme heat can exacerbate underlying health conditions such as cardiovascular disease, diabetes, and respiratory disorders. This means it's crucial to understand and address the health implications of rising temperatures. Vulnerable populations, including the elderly, children, and those with chronic illnesses, are particularly at risk. Maya, you must be getting the same questions I do for advice on how to stay hydrated, but also to think about things. For example, I have a lot of patients who have heart failure or who have kidney issues. So I can't just say, hey, just go drink a bunch of water, because that can also sometimes set off their chronic conditions. Maya, how do you think about this with counseling patients?
Yeah, Kavita, first of all, I have to acknowledge these numbers that you just read before. I think that they are astounding. I mean, I have so much to say and at the same time, nothing at all, simply because it is getting hotter. So it's like quite urgent. And in terms of thinking about my patients, yeah, those patients that have fluid restrictions, the truth is, Kavita, that we're talking about how can you stay in a cool place? And I mean, people have to have stable housing, or they've got to be in a hospital center and really under medical care. And if they are in transitional housing, like I used to work in the community, we had so many people that would truthfully end up in the hospital because they couldn't be in air conditioning. Because when you've got a fluid restriction, it's not like we can just say, hey, go drink 2 liters of water and you'll be fine. Like your fluid is restricted. So that's quite complicated. And in terms of my patients who have diabetes, I really think about how heat changes the way that the body sensitizes insulin, and that there can be real shifts in their blood sugars. I think about folks who have high blood pressure. And I think about, oh my gosh, when they sweat, that there can be this real loss of calcium, potassium, and that can actually increase blood pressure. And then I think about other folks who've got cardiovascular disease and the electrolyte disturbances around sodium, potassium, magnesium, those things being lost in sweat, and that there can be this really negative impact on their heart rate and some of the cardiometabolic demands. So Kavita, it's not as simple as drink water, add an electrolyte solution. It's really like, how can we get creative when I'm thinking disease specific and say, okay, well, these are the things that I want you to engage in and plan for. And then also kind of come up with a worst case. Well, how are we going to navigate this? It's not easy. Actually, I will tell you, Kavita, this reminds me of, I was training years ago for a race, and my running partner first had hyponatremia and then had hypernatremia. So not enough salt and then too much salt, and was in the hospital both times. And she was a young woman when we were training. And so I just think about this, as being pretty urgent for folks. And I also feel like, Kavita, that we're constantly trying to find these ways to hydrate well, stay cool. And, as I said before, it's hard when we're thinking about folks who are unhoused or unstably housed or marginalized, vulnerable populations that really don't have a choice in the matter, whether or not it's kids in cars, where we're just hearing so many more reports, or people who don't have homes or a roof over their heads. There's really no question that this is a public health crisis that we're dealing with. What do you think?
Yeah, I agree, Maya. I think that not only is it a public health crisis, but I'll actually get to kind of this issue of like children in cars. We're also seeing an increase, as we mentioned, those deaths. The worst kind of stories come like in the emergency room when someone like doesn't realize that they like literally accidentally left their child in the backseat of a vehicle, which unfortunately happens often. And so just a couple of reminders for listeners. If you have kids of any age, but generally speaking, kids go in the back seats because they're in car seats, just make sure that you put something with that car seat so that you kind of, what ends up happening are the parents that tell me that they didn't even remember that their child was in the back, is that we have these learned memories of doing things. And if it's our day to like take the kid to daycare, but then we switch with like a partner or a significant other or a spouse, then you forget, that person forgets. So I tell people, put like your purse or your briefcase or some set of like something else that you're going to have to reach into the back seat. I even tell people, put your phone. There's no really need for you to use your phone while you're driving. Put your phone back by the car seat, because that's often the one thing most of us kind of say, oh, do I have my phone on me? So that's like one thing with children in cars. And then in terms of public health and populations, we're seeing so many malls, large spaces, even movie theaters, Maya. When DC hit triple digits and did it early on in the summer, we saw a lot of facilities that kind of don't have a lot of people in them during the daytime get switched over into essentially cooling centers. And I think it's just, these are fine, but they kind of Band-Aids on a problem when you start talking to people in other parts of the country where they don't even have air conditioning. So let's talk about the fact that this is the summer of 2024. The Olympics are happening in Paris. I think a lot of people were shocked that many of these Parisian Airbnbs or apartments have no air conditioning.
No air conditioning, Kavita. None.
And because they don't need to normally. So add to that 100, 105 degree days with no air conditioning. And you can imagine that this is like a pretty big disaster. And it's not as easy as go buy a window unit to cool your room down. So I do think that there's a lot that we should and could be thinking about. I think that we have a lot to learn just as individuals to protect ourselves and our loved ones. I love your recipe, your back of the, kind of the back of the fridge. Like everybody's got water. Hopefully everybody's got some little bit of salt. You don't want to overdo it. Some lemon. I love the maple syrup juice. This is exactly what we need listeners to take stock of and make sure that they have. And that, remember, if you're very young or very old, this can be life-saving. So I'm very, very heartened to kind of talk about this issue with you, because the summer, unfortunately, Maya, it's not going to go away. That if the past indicates the future patterns, we're going to have longer summers, longer days, longer exposure, because some of us have to be outside or in places where we're working. So I think I actually have an incredible guest who could give our listeners and just teach you and me a little bit about how you tackle this, both as an individual and as a public health issue. Dr. Richard Carmona was the 17th Surgeon General of the United States. He's also a distinguished professor of public health at the University of Arizona. He's been trained in general and vascular surgery. True story, he was a deputy sheriff and a nurse and a medic in the Army. He's kind of done it all. So let's bring him into this conversation after this short break.
Hey, Well Now listeners, if you're enjoying the show and want to hear more, subscribe to our feed. New episodes come out every Wednesday morning. While you're there, check out our other episodes too, like last week's, where we got a gut check and talked about the important work our gut microbiome does for us. Check it out. As a registered dietitian, I know how important drinking water is. It's so important because we all want to stay well hydrated and healthy. That's why you've got to check out AquaTrue. AquaTrue purifiers use a 4-stage reverse osmosis purification process, and their countertop purifiers work with no installation or plumbing. And I have a countertop purifier at home, and I have to tell you, I love the ease, and I love knowing that I've got access to safe, clean drinking water, and everyone in my family enjoys it as well. AquaTrue comes with a 30-day money-back guarantee and even makes a great gift. Today, my listeners receive 20% off any AquaTrue purifier. Just go to aquatrue.com. That's AQUATRU.com and enter code WELLNOW at checkout. That's 20% off any AquaTrue water purifier when you go to aquatrue.com and use promo code WELLNOW.
Hey, it's Carvel Wallace, host of Slate's podcast How To, and we just hit our 5-year anniversary. That's over 250 episodes of life-changing advice on every topic imaginable. And so to celebrate, my co-host Courtney Martin and I recently talked with the show's founder, Charles Duhigg.
We had a guest on once, and we were talking about talking to your kids about sex. And she said, you would never have one conversation with your kids about table manners,
right,
and then assume that their table manners are going to be good for life, right? Instead, you have like 1,000 conversations with your kids about table manners.
Oh shit, Charles! Now I'm worried I haven't had enough table manners conversations. We definitely talked about sex a lot, but I don't know how much we've talked about table manners.
Just as long as they don't have sex at the table, they're good to go.
So far, so
as long
good.
as they know how to spoon, even if they don't know which spoon to use, it'll totally work out.
Oh, but
oh man. On How To, we answer your toughest questions with grace, wisdom, and humor, which is why 5 years on, we're still going strong. Listen to How To wherever you get your podcasts.
Welcome back. You're listening to Well Now. I'm Kavita Patel.
And I'm Maya Feller. So as the planet warms and the risk for heat-related sickness and death rises, Kavita and I both know how important it is to keep ourselves and our loved ones safe. I mean, it's only going to get hotter. Today, talking to us on heat as a public health crisis is Dr. Richard Carmona. He was the 17th U.S. Surgeon General serving under President George W. Bush. Rich, thank you so much for joining us. We are thrilled to have you here.
Happy to be with you, Maya, and happy to see my good friend Kavita.
So we always start with this question of wellness and how you quantify it. Rich, how do you think and define wellness?
Well, simply, I would say wellness is a state of optimizing all the body systems for your own performance, what that is. You know, there's a lot of definitions that have come out on that, but I think really it's optimizing your daily performance in whatever it is you do, walking, sleeping, eating, drinking, you know, all of those type of things.
That's great because there's so much that goes into wellness. I know that you've spent a lifetime working on trying to enhance people's wellness, But Rich, we're really probably like you. I know you're talking to us from the great part of the country, Arizona, as well as the rest of the Southwest, where there is not just extreme heat in that part of the country. Rich, we're seeing extreme heat across the globe. And I know you've dealt with this before and are dealing with it now. What are some of the health issues that you think about? And when you're talking to the public about extreme heat, what are some of the health issues you want to make people aware?
There's so many. I mean, you could fill a PhD dissertation, but I think what's important first is maybe the magnitude of the problem. There's about 500,000 deaths every year globally from heat-related problems. In the United States, if you look at the last 3 years, what you're seeing is every year more people are dying from heat-related problems. The other issue is when we look at who's dying, often it is the most vulnerable populations. It's people of color. It's people that are very old, people that are very young, people that have diseases, people on medications for cancer, for instance, or pulmonary disease. So we have a real intersection here of some bad things happening as things are getting warmer and more vulnerable populations are struggling, but also regular healthy people struggle with this as well. So that's why it is, in fact, a significant public health issue in our nation and the world.
And when you think about chronic conditions on top of that, so, we know that 1 in 3 people are pre-diabetic. We know that so many people also have either diagnosed or undiagnosed cardiovascular disease. How do you see heat stress affecting people with chronic conditions?
Well, the most important thing, I think, Kavita, as you well know, is that they are more vulnerable. People who, the very young, the very old, chronic diseases, all of those things impair your ability to respond to stress in your environment. So as things get warmer and you have less ability to regulate your body systems because you're on certain medications, or you're very young and haven't developed those systems fully yet, or you're very old and those systems are wearing out, you're more vulnerable. And hence you can suffer complications, even death, because of that.
So talk to us a little bit about how climate change has contributed to the increase in both the frequency and intensity of these heat waves that we're seeing globally.
There's a couple of things, and I'm going to be pretty blunt about some of these things as it relates to climate change, because, we live in a world of misinformation and disinformation today. We saw that during COVID. We see it during a lot of things, and many of these issues become politicized. And so the fact of the matter is it's getting warmer, period. It's getting warmer because we continue to use fossil fuels solely. About 3/4 of our energy generated by fossil fuels. And the fact is that those fossil fuels contribute to changing the atmosphere, being able to trap heat in our atmosphere, and things are getting warmer. So, people argue, well, it was going to get warmer anyway. Sure, that's probably right. It would get warmer anyway. But we are accelerating the warming. And as we accelerate the warming, there are many unanticipated challenges, including direct health. But there are things like we're seeing more diseases along the southern border that you wouldn't see, malaria, dengue, things like that. Mosquitoes are moving north. So there's a whole host of things that are coming together that are directly and indirectly related to heat, which are causing increased morbidity and mortality. And what they have in common is they're all preventable.
Not only is it all preventable, but we are actively kind of participating in making things worse.
Yes.
By not kind of moving. I think this is something we're all learning, Rich, is that these are issues. We call it, I think, health and all policies, right? How we deal with housing, we'll get into some of that because I think you've literally written the book on some of these issues. But when we think about kind of practical things, I know you're talking to family members and for listeners, people around, I would say much of the country, but especially I've had a chance to visit Dr. Carmona in Tucson, Arizona, and some of what I would call kind of his stomping ground. People stop him on the street and, ask him kind of random health questions. So Rich, when you're stopped on the street and you're dealing with, tell us what some of the temperatures are that you're dealing with in Arizona, kind of what practical steps can people do to protect themselves? I mean, of course, being inside during air conditioning would be optimal, but a lot of people are working and they don't have much of a choice. So what advice do you give?
Well, first and foremost, to increase awareness that you don't want that to sneak up on you and all of a sudden you're feeling lightheaded, passing out, things like that. And so the first advice is that us and me as a Surgeon General, Kavita, you as a health policy expert, being able to put the word out to educate people. And fortunately, we see a lot of that at the beginning of the summer this year. I saw many of the TV stations, radio stations issuing alerts, newspapers talking about alerts, and being aware of what heat can cause as it relates to unintended consequences. Because we're at a point now where it's not just heat. For instance, in Arizona, we're hitting temperatures close to 120 degrees. And we have months of days over 100 that go from about June through September. And so you have to think about people being able to recreate, just go and come from work, staying hydrated. So there's a whole lot of issues. But first and foremost, the awareness to the public that this is a public health problem. The second issue is, well, what can you do to protect yourself? Wear a hat, wear sunglasses, stay out of the direct sun as much as you can. Stay in air-cooled, air-conditioned areas as much as you can. Continue to drink water. Once you're thirsty, you're already a few percent down. Okay. And recognizing, as you look at your urine and it's real dark, you have a problem. Start drinking a whole lot of water right now. And stay away from any specialized beverages. The first best thing you can do is drink water. Don't make it complicated, and make sure that you stay hydrated during the day. And so what I tell people, for instance, in Arizona or even California, any place that's particularly warm, the inner areas of California are just like Arizona. It's desert. That, have your bottle of water with you. Keep sipping all the time, because once you're feeling thirsty, you're already running a deficit.
Yeah, you're already running a deficit. And I want to just underscore, I think a lot of people do feel like these specialty beverages might hydrate more. They can actually, especially with caffeine, I often tell people if it's not clear, it's probably not going to do you much good for hydration. I'm sure Maya can commiserate, but I think people feel like the more that's added to it, it could potentially prevent you. But I've often seen people drinking caffeinated beverages and they don't kind of understand how that'll suck actually some of the water out of your cells in a way that can make you more dehydrated.
And I would add to that, Kavita, not only caffeine, but salt that are in some of these caffeine, as well.
Yeah.
That tend to dry you out even more.
Yeah. So what you eat as well. We'll talk a little bit more about how all of this comes to play at a larger level, but let's take a break right now. When we come back, we'll hear more from Dr. Richard Carmona on heat and its effect on our health. You're listening to Well Now from Slate. I'm Kavita Patel.
And I'm Maya Feller. And we're continuing our conversation with Dr. Richard Carmona. So, Rich, as we're thinking about heat-related illnesses, could you share some of the signs and symptoms with us?
Well, generally, Maya, what happens is initially when you start to suffer from heat-related illness, you'll feel a little tired. When you go to urinate, it may be a lot less and it may be dark and concentrated. You may start with just some cramping and muscle spasms and just feeling odd that, gee, this is not good. And then if it progresses and you move to heat exhaustion, you're having cramps, you're getting excessive sweating, your skin is getting clammy, you might start feeling dizzy, you might get a little fever. Okay, so this is a progression. So you'll go from these cramps and not feeling good, moving on to exhaustion. And with the exhaustion, again, cool, moist skin, increased pulse rate, might be nauseous. You might be kind of lightheaded. And then if that's not taken care of, you move into the next phase, which would be heat stroke. And really that's bad because when you have a heat stroke, the body has lost its ability to regulate temperature. Your body acts as an air conditioner. You sweat, it evaporates, it starts to cool you. Okay. But you lose all of that ability. And at that point, you're getting dizzy, headaches. You may have lost consciousness. There may be delirium, that you're not sounding right. Like if somebody's asking you, doing a mental status check, that you really can't answer those questions well. And, once you get to a heat stroke, that's a life and death situation. So on any of these where a person is outside and starts feeling the cramping and the muscles, and you're still cognitive, start drinking.
So, Rich, how does someone know that it's time to seek medical help?
So just tired and feeling you're sweating a lot, at that point, you should start thinking, where's the air conditioner? Where's someplace I can cool off? Where can I get water? When you start feeling lightheaded, you're getting cramps and stuff like that, you're starting to move into more of a heat exhaustion phase. And at that point, if you don't have immediate access to drinking or doing something, you need to ask somebody for help. Somebody should call 911 system, have EMTs come and evaluate you, and maybe even transport you, because that does become a medical emergency. Because again, if you're very young and you're very old and you have chronic diseases, you're going to decompensate a lot faster. So there's a window there, but I always say, don't try and tough it out, because it may get too late that you don't have the ability anymore to compensate for these changes. So best when you start feeling like that, take aggressive stance, drink, get into a cool area, stop your activities, all of that. And if you are progressing and there's no way that you can get the help or get to a cool area, you're out in the middle of the desert, something, then have somebody call 911 and get the professionals there to start to care for you.
I would love to talk a little bit about disaster preparedness and kind of get a picture of what emergency personnel do in order to be prepared for warmer climates. Because this is something that, as you talked about the importance of getting the message out, what's actually happening on the ground with regard to emergency personnel and how are they getting ready for this?
Well, in most communities where there are public health departments, and that's another problem that, often public health departments are more closing than opening. And so they have a large geographic area often that they're responsible for. So first and foremost, at the beginning of a warm season, they start to remind people that be careful, stay indoors as much as you can. In fact, in some communities, they'll even have cooling centers where you can go into a building, a gymnasium, an office building, and cool off if you're out. So all of this information is out there so that the public is able to understand what resources they have if they're outside and not feeling so well. As far as the first responders, which would be EMTs and paramedics, most of them as well are carrying extra water on their vehicles. They're having to stay hydrated because on those hot days, they're out there doing rescues. They're out there saving people. So it's up to us to make sure that they stay hydrated as well. So they're usually prepared and transporting. So with public health announcements, with hospitals and emergency rooms, also putting out messaging, trying to prepare the public for this. The infrastructure is there to be able to, what we call surge, that is move up quickly when and if there's a demand. And so, as I said, with some of the numbers we're hearing with last year having 2,302 heat-related deaths, and that's just deaths, but there's a lot of sick people in addition to those 2,302 that needed to go into a physician's office or into a hospital to be rehydrated. And then if they have chronic diseases, it may mean an admission and managing those problems that have been exacerbated by the heat as well. So I think that from emergency management and preparedness, this is all part of the structure of our EMS systems that are prepared to handle this, but more importantly, working to prevent any of these problems by appropriate education in the community.
Yeah, that really makes a lot of sense to me, the combination of the prevention and then also having the emergency personnel on the ground being ready and prepared.
Well, something that, Rich, there's so many kind of layers to your career that informs. I know we're talking about heat, and that's like it's a very kind of, I hate to say it, it's something we're all feeling, no matter where you are listening to this. We're seeing record degree temperatures, but it would kind of be remiss if I didn't point out that a lot of what you've learned, you've had a career as a nurse, you've actually had a career as a deputy sheriff. So a lot of what I think you bring to bear when you talk about kind of setting up, cooling centers or thinking about responses comes from your role as being truly one of the first responders. Can you just share with us it could be a specific story or just some of the lessons you've learned over the years about all of what it takes to develop this frontline response?
Well, Kavita, thank you for reminding me of my aging. So
I do it out of love because I have the same I have the same reminder on a daily basis.
I've been a first responder for over half a century, and just about every job I've had, starting out as an ocean lifeguard, as an EMT paramedic, as a combat medic, U.S. Army Special Forces in Vietnam, and then as a doc running a hospital, a healthcare system, EMS system, being responsible for paramedic and EMT education. So I was there at the beginning of EMS, and now I'm still there and haven't given up. So there are many issues. I can think back early on, just being an ocean lifeguard with people out at the beach drinking, getting dehydrated. I remember one rescue in particular, a gentleman who we knew going into the water looked like he'd have problems because he was unsteady, been drinking all day, and in fact was quite dehydrated. And so he went down, rescue team rescues him, comes out, and we can't find a pulse. We have to start CPR on him. Eventually, we saved him, but it was complicated by the fact that he was severely dehydrated and had a lot of alcohol on board, so made the resuscitation much more difficult. But, the IVs were started, paramedics came in, we sent the person off. I can remember in the military, especially when I was in Vietnam, where it gets very hot, and you're in a combat zone, and we're wearing lots of heavy equipment, and we get dehydrated really quick. And the challenge there is it's really hard to be able to be drinking all the time, because often during your missions, you're looking for water because, it's a jungle situation. It's very, very hot. And I can remember myself feeling the ravages of dehydration, getting tired, little muscle cramping, soreness, and even bordering on, a little bit of confusion at times. So those are, personal experiences. And then over the years, numerous cases of having run the trauma and emergency centers in the summers and having to resuscitate people coming in with severe dehydration or, in fact, even heat stroke, where they can't regulate their temperature anymore. And that's one step before dying right there.
So what stands out for me there is the many different ways that people actually arrive at this point of being critical. So it's everything from being at the beach to work situations that you yourself don't have control of to just plain old exposure to the climate over time. And I think that that's something that will resonate with the folks who are listening to this. So Dr. Carmona, I know that you've been really active in the state of Arizona's response to these crises, especially around COVID-19, and that really when we're thinking about heat, that's not an exception. How do you feel like local governments and organizations can actually learn from Arizona? Like, should they be setting up cooling centers or other resources during heat waves, or even some of the examples that you just mentioned? Should we be training our first responders differently, or young folks who were lifeguards on the beach? Like, what should we be doing, and how can we learn from some of the work that you've put in place?
I'll start at the national level. We have what's called a national response framework that Kavita knows about very well from her days at the White House. And this is the organizational structure that our nation uses that pretty much links together all of the local EMS systems in the country to work together in very small disasters or very big disasters. And the term we use is surge. So when you have a national disaster, often there's not a single fire department for the whole nation or a single emergency room, but lots of EMS systems come together. There's what they call compacts and mutual aid, and they surge, they come together. So when we look at let's say a catastrophe like Katrina, which was in the Southeast a number of years ago, the response there was from a lot of different places, actually many different states who sent DMATs, which are disaster medical assistance teams, and others that would come and help. So the point being that the nation has a framework that says, this is what we do for all hazards. All hazards means anything that can affect the health, safety, or security of an individual or the United States. And so built into that plan is all of these things. What do we do when bad things happen? So it's the same thing you do at a local level in a small community, in any of the communities you may be in Washington, D.C., Virginia, Tucson, Arizona, San Diego, California. And local EMS has that infrastructure. But when the issue becomes one that the threat or the challenge exceeds the capabilities of a small community, then others come in and provide assistance. And that goes right up to a national level where we could even invoke certain laws that allow the president to seize control of the National Guard. And so the public should rest assured there is a system that is there from the local to the national level. And within those responses, of course, is the knowledge and ability to address heat-related problems, because our disasters and catastrophes don't happen at convenient times. They can happen on July 4th. They can happen in the middle of August in the West when it's 120 degrees. So the capabilities have to be built in as well. So on a daily basis, the authorities are embedded in each of the community's public health departments and EMS agencies to educate the public. And you'll hear often, I just heard some announcements in New York not too long ago, a few other states, that they put out information about cooling centers. You know, the other groups to think about, what about the homeless people that are living, you know, on the margins of society and it's 120 degrees and they don't have the option to turn on the air conditioning, those kind of things. So it starts to get really, really complex when you start to look at the complexity of the problem. And in the more primitive societies where you don't have air conditioning, you'll find that there's a higher morbidity and mortality from heat-related problems because there's no place to go. On the other hand, in large urban centers where we have big places that are air conditioning, in the United States, we have pretty much 90% of the places are air conditioned, or you're close to someplace air conditioned, as opposed to if you're in India or other countries where you may have half that much. So you can see how the people would be vulnerable. So understanding the capabilities of your community, where you are, understanding who are the vulnerable populations, for instance, the homeless, and ensuring that they have access. So I see in many communities, as soon as the heat goes up, you'll see volunteer groups going out to the homeless shelters and providing drinks, making sure people get into the school gymnasium that's air conditioned for the very tough times. So it's all of those things being put together, and they vary from community to community because of the population density, because of resources that may or may not be available. But the more we can do to educate the population prospectively and make sure that they truly understand the risks of this and what options they have to ensure for their health and safety, that's a good thing.
Rich, talk to us a little bit about kind of urban cities versus desert kind of settings. There's a little bit of like, this might be obvious to people, but there is something in urban cities, kind of like a heat island, if you will, kind of becomes like a vortex.
Yes.
Can you describe the dynamics? Because they're clearly different. The heat is not necessarily equal in all parts. Describe a little bit of those differences, because you've been in both. You're living in both.
So I think it's a great question, Kavita. So let's look at the urban jungle. Let's take Washington, D.C. or New York City as an example, okay? Lots of people concentrated in one area. So you have the rush hour, and we're literally shoulder to shoulder with thousands of fellow citizens. Whether on the metro or a subway, whether in an elevator or concrete jungle, large verticals of concrete buildings of which house thousands of people. So each of those people are generating almost 100 degrees of temperature because they're 98 or so, 99 degrees. And the ambient temperature outside might be 100, 105, 110. So basically, not only the warming that traps that heat, but you're trapping the heat in those big buildings. Air's not getting through to be able to, and depending on if it's very dry or if it's very humid, there's a little bit of a difference. So you're trapping heat in these areas. People don't have space between them for air to circulate. So you tend to potentiate the heat then, and because of that, accelerate the ravages of heat-related disease.
I can tell you, Rich, as someone who lives in New York City, that is exactly my experience when I walk into certain very populated areas. I live in the outer boroughs, so there's a little bit more space. But when I go into the city, it feels hotter every single time I go there.
Yes, and you know, and as Kavita asked, like the difference in the rural areas, you have much more open space. You have less population density. You know, there's big space between people. So there's more options for you to duck into a local store or into a school and cool off, as opposed to the mass of people moving through the streets in New York or Washington, getting to and from work or shopping. So all of those things contribute to this. And often I think the public doesn't think about those things as it relates to their risk and heat-related disorders.
That is absolutely right. I think you're right that it's not something that's part of our consciousness when we're thinking about where we live in relation to those heat risks. Now, as the Surgeon General, you've really had this chance to lead our nation's public health service. So I'd love to know how your experience as a national health expert has really guided your philosophy on how we can and probably should navigate other public health crises.
Well, thanks for that question as well. And probably it was the big challenge that all Surgeon Generals live with every day. You know, with the job description to protect, promote, and advance the health, safety, and security of the United States, it pretty much encompasses almost everything from agriculture to zoonosis, A to Z, and everything in between. So, you know, I would say from my standpoint, the job is one where you always feel a sense of urgency. You're always worried about what's coming around the proverbial corner that you're going to miss or you don't know. And so, you know, a lot of sleepless nights and days because of the immense responsibility you have to be able to work with others in government to address these challenges. And of course, this is a significant one as it relates to heat-related illness and the numbers of deaths and the numbers of preventable challenges, illnesses that are caused by these. So from a Surgeon General standpoint, to be a communicator, get the word out, speak to the public, let them know about their risk, to be able to work with public health departments around the country to ensure that they have the resources, they have the communication skills, and they are aggressively putting this information out. So 50 states, and then we have our territories as well. And the challenge, of course, as a nation that really understands the importance of immigration, and we have people that are new, that have different cultures and different languages, and we have to reach them as well. So they become more vulnerable because they may not be understanding the newscast, the radio, or what they're seeing. They may not have access to healthcare right away. So there's a whole host of issues that are germane to this, including just regular Americans who are not tuned in and understand the risk of heat. So from my standpoint, as a Surgeon General, working with public health departments and leaders around the country, working with organizations like the American Public Health Association, organizations around pediatrics, geriatrics, getting those words out, and in toto, being able to reduce morbidity and mortality.
Mm-hmm. So, Rich, in closing, is there anything else you feel like you'd want to share that, because you brought up so many wonderful nuances that I think will be new to people listening, even right now that you just said, right, we've got people that come from different places. There could be a language barrier. There could be cultural differences. Is there anything else that you want to share with us before we close out?
I would say the most important thing, which would encompass what we're talking about today, heat-related illness, is that most everything that we deal with in our society as it relates to disease is preventable or at least mitigatable. The disease and economic burden we have from heart disease, from cancers, accidental injury, what they have in common is much of it is preventable if we plan accordingly. If we, as we age, continue to stay physically active, eat healthy, never smoke, reduce risk in our environments, wear a seatbelt, wear a helmet, whole list of things that sound almost like, doesn't everybody know that already? In fact, all of those things can contribute. Our average life expectancy is about 80 years now, plus or minus, women a couple of years more than men. But back at the turn of the 20th century, life expectancy was about 45, 46 years old. We've done pretty well. But it's really less about the advanced surgery and drugs. It's more about clean water, sanitation, and improved public health that saves populations. So what the public can do to, I would say, live longer, younger, happier, healthier, and cheaper is to invoke a lot of these basic things. Eat healthy, move every day, remove risk from whatever the environment it is you're in, whether it be air pollution, water pollution, all of those things. if everybody was more alert and involved with dealing with all the issues in their particular environment that they could remove, we could truly reduce the cost of care and improve the quality and quantity of life. So I would say emphasize prevention. We are the best in the world with treating disease, but we can do better with prevention.
I completely agree. Like, I kind of want to jump out of my chair and say, yes, 100%.
We can use the energy out in the streets, for sure.
Dr. Rich Carmona is a physician, public health official, and the 17th Surgeon General of the United States. Rich, thank you so much for joining us.
My pleasure. Thank you, Maya and Kavita. Always happy to help you guys.
That's our show this week. Well Now is produced and edited by Vic Whitley-Berry. Ben Richmond is Slate's Senior Director of Podcast Operations. Alicia Montgomery is Vice President of Audio.
We'd love to hear from you. Email us at wellnow@slate.com. Support our show by becoming a Slate Plus member. You'll get to listen to this show ad-free, as well as hear bonus material from some of your other favorite Slate podcasts, like Political Gabfest, Slow Burn, and more. You'll also have full access to all articles on Slate's website. And be sure to tune in next Wednesday as we tackle another part of the wellness industry. I'm Maya Feller.
And I'm Kavita Patel. Thanks for listening.